they prioritize money and profits over health. And that's what insurances have done, is they've sort of taken advantage of their role. We've got a broken system because they're there to help, and they're not supposed to be there to add hurdles into treatments.
Let's talk about these insurance companies. When you say that they are the three middlemen, or the ones, the biggest issues, what are some of the things that concern you the most about the whole insurance game? Because, there's a lot of patients be like, and there's some doctors, probably more patients than doctors, that are like, oh, insurance is great. Insurance should cover everything. What's your beef with them, if you will?
Yeah, my beef with them is that they don't. My beef with them is that they prioritize money and profits over health. And I think, again, as an entrepreneur myself, I understand the need to prioritize profits for your entrepreneurial venture. But the problem is, when it comes to human health, it's a slippery slope. And that's what insurances have done, is they've sort of taken advantage of their role, and they've sort of really done a spectacular job from an entrepreneurial perspective of taking advantage and taking more control than what they should have, and lobbying the right way, et cetera, et cetera. So what you have is just this really big behemoth in between the patient and the doctor that really shouldn't have the control that they have. And so one example that I'm sure everybody can identify with is, something simple like the prior authorization. When a patient comes to a physician to get treatment, or to get a test, or to get a medication, and the insurance then makes it super burdensome to actually get that treatment or medication, then we've got a broken system, because they're there to help, and they're not supposed to be there to add hurdles into treatments. And that's what they are. They're a hurdle.